CEN Written Exams Schedule. Question 1. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50ths mmHg? Option A. Atrial fibrillation with rapid ventricular response. Option B. Supraventricular tachycardia, SVT. Option C. Ventricular tachycardia with a pulse. Option D. Atrial flutter with 2:1 block. The correct answer is option C. Ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario. Question 2. A 55-year-old male presents with chest pain radiating to the jaw, diaphoresis, and nausea. The 12-lead ECG shows ST segment elevation in leads V1 V4. Which intervention is the priority? Option A. Administer morphine 4 mg 4. Option B. Administer aspirin 324 mg chewed. Option C. Prepare for emergent percutaneous coronary intervention, PCI. Option D. Obtain a chest X-ray. The correct answer is option C. Prepare for emergent percutaneous coronary intervention, PCI. This patient is experiencing an ST segment elevation myocardial infarction, STEMI, indicated by ST elevation in anterior leads V1 V4. The priority is rapid reperfusion. The goal is door-to-balloon time of 90 minutes or less for PCI. While aspirin and morphine are important adjuncts, they do not address the underlying occlusion. Chest X-ray is not the priority. Door-to-needle for fibrinolysis is 30 minutes if PCI is not available. Question 3. A patient with a dog bite wound presents with redness, swelling, and purulent drainage. The CEN should: Option A. Irrigate the wound and prescribe antibiotics. Option B. Culture the wound and start empirical antibiotics. Option C. Close the wound primarily. Option D. Apply a pressure dressing. The correct answer is option B. Culture the wound and start empirical antibiotics. Infected wounds, cellulitis, abscess, require cultures and antibiotics. Dog bites can be infected with Pasteurella, Capnocytophaga, and other organisms. Empirical antibiotics, amoxicillin clavulinate, are often started. The wound should be opened, drained, irrigated, and debrided. Primary closure is generally not recommended for infected wounds, they are left open for drainage. Question 4. A patient with a stroke is within the 4.5-hour window for TPA. The CEN should: Option A. Obtain a CT head to rule out hemorrhage. Option B. Check the blood pressure, target 185/110 mmHg. Option C. Prepare for TPA administration. Option D. All of the above. The correct answer is option D. All of the above. TPA is indicated for acute ischemic stroke within 4.5 hours of onset. The protocol includes CT head to rule out hemorrhage, blood pressure control, 185/110 mmHg, and preparation for TPA administration. If the patient is a candidate, TPA is given, and the patient is monitored in a stroke unit. Question 5. Which finding is classic for cardiac tamponade? Option A. Widened pulse pressure. Option B. Beck's triad, hypotension, muffled heart sounds, JVD. Option C. Kussmaul's sign. Option D. Pericardial friction rub. The correct answer is option B. Beck's triad, hypotension, muffled heart sounds, JVD. Beck's triad is the classic presentation of cardiac tamponade, hypotension, from decreased cardiac output, muffled heart sounds, fluid in pericardial sac, and jugular venous distension, impaired right heart filling. Other findings include pulsus paradoxus and electrical alternans on ECG. Emergent treatment is pericardiocentesis. Pericardial friction rub suggests pericarditis. Question 6. What is the correct compression to ventilation ratio for adult CPR with an advanced airway in place? Option A 30:2. Option B 15:2. Option C continuous compressions at 100-120/min with breaths every 6 seconds. Option D continuous compressions at 80/min with breaths every 8 seconds. The correct answer is option C. Continuous compressions at 100-120/min with breaths every 6 seconds. When an advanced airway, ET tube or supraglottic airway, is in place during adult CPR, continuous chest compressions at a rate of 100 to 120 per minute are delivered without interruption for ventilations. 1 breath is given every 6 seconds, 10 breaths/min. The 30:2 ratio is for CPR without an advanced airway. Question 7. A patient presents with sudden onset of severe, sharp, lower abdominal pain radiating to the flank, nausea, and hematuria. Which diagnosis is most likely? Option A appendicitis. Option B renal calculi. Option C ovarian torsion. Option D diverticulitis. The correct answer is option B. Renal calculi. Renal calculi, kidney stones, present with sudden, severe flank pain, renal colic, radiating to the groin, nausea, vomiting, and hematuria. CT scan without contrast is the diagnostic test of choice. Pain control, 4 opioids or NSAIDs, and fluids are the mainstays of treatment. Ovarian torsion presents with adnexal pain and should be considered in female patients. Question 8. A patient with cyanide poisoning, from smoke inhalation, presents with confusion, dyspnea, and a normal SpO2. The CEN should anticipate. Option A sodium thiosulfate and hydroxycobalamin. Option B oxygen only. Option C naloxone. Option D atropine. The correct answer is option A. Sodium thiosulfate and hydroxycobalamin. Cyanide poisoning often occurs with smoke inhalation. Symptoms include confusion, dyspnea, seizures, and lactic acidosis. SpO2 may be normal because oxygen is not utilized by the tissues. Hydroxycobalamin, vitamin B12A, is the first-line antidote, binds cyanide to form cyanocobalamin. Sodium thiosulfate is a second-line agent. Oxygen is supportive. Question 9. A patient with thyroid storm presents with fever, tachycardia, and confusion. Which medication is used to reduce thyroid hormone levels? Option A propylthiouracil, uracil, PTU. Option B methimazole. Option C propranolol. Option D. All of the above. The correct answer is option D. All of the above. Thyroid storm is managed with medications that block thyroid hormone synthesis, PTU or methimazole, and beta blockers, propranolol, to control symptoms, tachycardia, tremors, hyperthermia. PTU is preferred because it also blocks the conversion of T4 to T3. Cooling, 4 fluids, and dexamethasone are adjuncts. The CEN should anticipate ICU care for these patients. Question 10. A patient presents with testicular pain, dysuria, and a fever. The testicle is tender. Which diagnosis is most likely? Option A testicular torsion. Option B epididymitis. Option C orchitis. Option D hydrocele. The correct answer is option B. Epididymitis. Epididymitis is inflammation of the epididymis, often due to infection, UTI, ST. It presents with gradual onset of testicular pain, swelling, tenderness, fever, and sometimes dysuria. It is differentiated from torsion by gradual onset, versus sudden, and presence of fever. Doppler ultrasound shows increased blood flow in epididymitis, versus decreased in torsion. Treatment includes antibiotics and NSAIDs. Question 11. A patient with capacity has a living will that states do not intubate. The patient is in respiratory failure. The CEN should: Option A, intubate the patient. Option B, not intubate the patient. Option C, call the family to ask for permission. Option D, ask the patient's primary nurse. The correct answer is option B, not intubate the patient. A living will, or advance directive, is a legal document that states the patient's wishes regarding life-sustaining treatment. The patient has capacity and a valid living will stating do not intubate, so the CEN should not intubate the patient. The healthcare team should respect the patient's autonomy and end-of-life wishes. The family cannot override the patient's wishes unless the patient is incapacitated. Question 12. A patient with a suspected pneumothorax has unilateral decreased breath sounds and tracheal deviation. The CEN should: Option A, administer supplemental oxygen. Option B, prepare for needle decompression. Option C, obtain a chest X-ray. Option D, place the patient in a supine position. The correct answer is option B, prepare for needle decompression. Tracheal deviation with decreased breath sounds suggests attention pneumothorax, a life-threatening emergency requiring immediate needle decompression. Oxygen is given but does not treat the underlying pathology. Chest X-ray should not delay treatment. The patient should be positioned upright if possible. A supine position can make the diagnosis more difficult. Question 13. A patient with frostbite to the fingers should be managed with: Option A, rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Option B, dry heat, e.g., warm blankets. Option C, massage to the affected area. Option D, surgical debridement. The correct answer is option A, rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Frostbite is managed with rapid Ruhrmeng in warm water at 37 to 40 degrees Celsius, 98.6 to 104 degrees Fahrenheit, for 15 to 30 minutes. Ruhrmeng should be done until the tissues are thawed. Analgesia is needed due to pain. Dry heat, e.g., warm blankets, is not recommended as it can cause burn injuries. Massage can cause tissue damage. Surgical debridement may be necessary after Ruhrmeng if necrosis occurs. Question 14. A patient presents with acute chest pain, shortness of breath, and a pericardial friction rub. Which ECG finding is most characteristic? Option A, ST segment elevation in all leads. Option B, PR segment depression and diffuse ST elevation. Option C, Q waves in leads 2, 3, AVF. Option D, tall, peak T waves. The correct answer is option B, PR segment depression and diffuse ST elevation. Pericarditis is inflammation of the pericardium, presenting with acute chest pain, pleuritic, better leaning forward, a pericardial friction rub, and diffuse ST segment elevation, often concave upward, with PR segment depression. It is distinguished from STEMI by the lack of reciprocal ST changes and the diffuse nature of ST elevation. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 15. A patient with an amputation of the finger is brought to the ED. The amputated part should be: Option A, placed directly on ice. Option B, wrapped in moist gauze and placed in a sealed bag, then on ice. Option C, placed in a dry bag. Option D, discarded. The correct answer is option B, wrapped in moist gauze and placed in a sealed bag, then on ice. The amputated part should be wrapped in moist gauze, placed in a sealed plastic bag, or container, and then placed on ice, not directly on the ice. This preserves the tissue for potential reimplantation while preventing thermal injury from direct ice contact. The CEN should ensure rapid transport with the patient and the amputated part. Question 16. A patient with COPD and a history of hypercapnia is being treated with oxygen. The CEN should aim for a target SpO2 of Option A 100%, Option B 94 to 98%, Option C 88 to 92%, Option D 85 to 88%. The correct answer is Option C, 88 to 92%. For patients with COPD and chronic hypercapnia, CO2 retention, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia, depressing the hypoxic drive. The target for healthy patients is 94 to 98%. High oxygen concentrations should be avoided in these patients. Question 17. Which of the following is the most effective approach for de-escalating an agitated patient? Option A. Use a firm, loud voice to establish authority. Option B. Maintain a calm, non-threatening tone and provide personal space. Option C. Immediately call security for assistance. Option D. Restrain the patient. The correct answer is Option B. Maintain a calm, non-threatening tone and provide personal space. De-escalation is a key skill for emergency nurses. It involves using a calm, non-threatening tone, maintaining personal space, acknowledging the patient's feelings, and allowing them to express themselves. Firm, loud voices can escalate agitation. Security may be needed if de-escalation fails, but it should not be the first approach. Restraints are a last resort. Question 18. What is the chain of custody in the context of forensic evidence? Option A. The sequence of people who handle a sample, ensuring it is not tampered with. Option B. The chain of command in the ED. Option C. The medication administration record. Option D. The patient's medical records. The correct answer is Option A. The sequence of people who handle a sample, ensuring it is not tampered with. The chain of custody is the documentation of every person who has handled a piece of evidence, e.g., blood, urine, clothing, from the time it is collected until it is presented in court. Maintaining the chain of custody ensures the evidence is not tampered with, lost, or contaminated. This is crucial in forensic cases, sexual assault, violence, etc. Question 19. A patient with cardiogenic shock has a cardiac index 2.2L/min/m superscript 2 and elevated filling pressures. Which finding would the CEN expect? Option A. Warm, dry skin. Option B. Cool, clammy skin. Option C. Bounding pulses. Option D. Widened pulse pressure. The correct answer is Option B. Cool, clammy skin. Cardiogenic shock is characterized by decreased cardiac output and increased systemic vascular resistance, SVR, resulting in cool, clammy skin, oliguria, and hypotension. This is in contrast to distributive shock, septic or neurogenic, where skin is warm and dry due to vasodilation. Management includes inotropic support, dobutamine, and vasopressors, norepinephrine. Question 20. Which concept is part of the Just Culture framework in nursing? Option A. Balancing accountability and safety with a non-punitive approach to errors. Option B. Blaming the nurse for errors. Option C. Punishing all errors. Option D. Avoiding reporting errors. The correct answer is Option A. Balancing accountability and safety with a non-punitive approach to errors. Just Culture is a framework that balances accountability and safety, promoting a non-punitive approach to reporting errors. It distinguishes between human error, at-risk behavior, and reckless behavior. The goal is to improve patient safety by encouraging reporting and learning from errors without fear of punishment. It is the foundation of a safety culture. Question 21. A patient is suspected of being a victim of human trafficking. The CEN should. Option A. Notify security and social work. Option B. Notify law enforcement. Option C. Provide a private space for assessment. Option D. All of the above. The correct answer is option D. All of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential. Question 22. What is the initial fluid of choice for a patient with hypovolemic shock? Option A. Lactated Ringer's solution. Option B. Normal saline, 0.9% NaCl. Option C. Dextrose 5% in water, D5W. Option D. Blood products. The correct answer is option B. Normal saline, 0.9% NaCl. Normal saline, 0.9% NaCl, is the initial fluid of choice for hypovolemic shock, hemorrhage, trauma, etc. It is isotonic and rapidly expands intravascular volume. Lactated Ringer's is also acceptable but should be avoided in liver failure. D5W is not appropriate for volume resuscitation, it distributes into total body water. Blood products may be needed, but crystalloids are the first line. Question 23. A patient presents with acute pelvic pain, fever, and cervical motion tenderness. Which diagnosis is most likely? Option A. Ovarian cyst. Option B. Pelvic inflammatory disease, PID. Option C. Endometriosis. Option D. Ovarian torsion. The correct answer is option B. Pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs, usually caused by sexually transmitted infections, chlamydia, gonorrhea. It presents with pelvic pain, cervical motion tenderness, chandelier sign, fever, and abnormal vaginal discharge. Treatment involves antibiotics, broad spectrum. PID can lead to infertility, ectopic pregnancy, and chronic pelvic pain if untreated. Question 24. A patient with COPD presents with severe dyspnea, confusion, and cyanosis. ABG shows pH 7.25, PaCO2 65 mmHg, PaO2 55 mmHg. The CEN should anticipate. Option A. Non-invasive positive pressure ventilation, BiPAP. Option B. High-flow oxygen via non-rebreather mask. Option C. Bronchodilators only. Option D. Immediate intubation. The correct answer is option A. Non-invasive positive pressure ventilation, BiPAP. This patient is in acute respiratory failure with hypercapnia and acidosis. BiPAP is the first-line intervention for COPD exacerbations with respiratory acidosis, as it can reduce the need for intubation. High-flow oxygen should be used cautiously in COPD patients to avoid suppressing the hypoxic drive. Bronchodilators should be given, but BiPAP is the priority for this acidotic patient. Question 25. A patient who is 8 weeks pregnant presents with vaginal bleeding and unilateral pelvic pain. Which diagnosis should the CEN suspect? Option A. Miscarriage. Option B. Ectopic pregnancy. Option C. Placenta previa. Option D. Normal pregnancy. The correct answer is option B. Ectopic pregnancy. Ectopic pregnancy should be suspected in any woman of childbearing age with abdominal/pelvic pain and vaginal bleeding, especially with risk factors, history of PID, tubal surgery, or IUD use. Unilateral pelvic pain, hypotension, and shock can occur with a ruptured ectopic pregnancy. Quantitative HCG and transvaginal ultrasound are diagnostic. Ruptured ectopic pregnancy is a surgical emergency.